Hi, for this portion of the video, we'll be assessing Matt's chest, cardiovascular, and peripheral vascular system. First thing we want to do is inspect the neck. We want to make sure that there's symmetry, making sure that there's appropriate color, no mass, no lesions, no tenderness. And then also we want to assess for any jugular venous distensions, any JVDs that would warrant further diagnostics and tests to rule out heart failure. So first thing we want to do is inspect, and we'll have the patient look to the left, and nice, even, flat veins here. I'm not seeing any distension, which is good. And go ahead and look towards me. And same goes for the left side. After inspecting, we want to palpate. We want to palpate the carotid arteries and also make sure that there are you don't feel any thrills, and then also auscultate to make sure you don't hear any breweries. And we can rate the strength of the pulse that we feel, 0 to 3, 3 being bounding, 1 being weak and thready, and 2 being normal. His is normal. Now we want to move down to the chest wall. We want to inspect, look for any deformities, any signs of chest pain, any clenching of the chest. Also palpating the skin, see if there's any diaphoresis, any pallor, cyanosis. Color change is a big deal because it informs us if there's adequate oxygenation and also if there's compromise of the vasculature or if he's having an acute coronary syndrome or distress. He's not in any acute distress, which is good. And now we're going to feel and palpate the chest wall, feeling for any pain, any knots, any crepitus. And there is not any. At this point, we're going to listen. We're going to start at the aortic section, which is going to be at the second intercostal space on the right side, next to the midclavicular line. After the aortic, we're going to go to pulmonic, which is across from it on the left. That's the aortic. Pulmonic. First point, which is about the third intercostal space. Followed by the tricuspid. And the point of maximum sound for the heart is going to be at the mitral, which is the fourth or fifth intercostal space, midclavicular line on the left side. Right here. We want to hear for the S1 and S2, which I hear bumped up, bumped up, bumped up. So now we want to ask the patient to turn towards the left side, which is where we'll have a better angle to see if there's any gallops, if there's S3s or S4s, possibly if there's any fluid around the heart and lungs. This is a good point to make note of that. This is the best position to listen for that. Okay. Good, you can turn back around. So, now that we've assessed the heart and it sounds great, we have fluid on board, I didn't hear any adventitious sounds in his lungs, now we can move down to the vascular system. First thing that we want to do is the carotids, which we already did, sounded good, felt good, and now we want to move down to the radial pulse, which is on the thumb side. And we want to check to make sure it's not bounding, make sure it's not weak or thready, and we want to make sure that it's equal. Also in the ulnar aspect, which it does. After we take this note, we want to then feel and palpate on the opposite side to compare the two. Don't feel any irregularities, no heaves, bounding. Feels equal. I've noticed in the past with patients who have AFib or a flutter, you can actually feel it in the radial pulse, and luckily for him, he doesn't have that, and I did not feel it, so everything felt normal. Moving along the fingers, we also want to check cap refill. Anything less than 2 is what we want to look at. This shows adequate oxygenation and also adequate blood flow. Pressing down on the nail bed, a nice pink color, comes back less than 2. That's what we want to look for. And the size and shape of the nail, the contour, the texture, the color, and the shape all look within normal limits. See that hand over there? Excellent. Moving down the body, popliteal arteries are felt behind the knee. So we're going to grasp it like a C cup. That there. Okay, and then you've got a nice bounding pulse behind the knee. And we want to cup the other knee and make sure that it's felt similar. Okay. Also looking at the legs, we want to make sure that the color is adequate. Hair on the toenails is a good sign that there is adequate blood flow. And also the nail beds too, we want to make sure that they're nice and pink, which his is, and his are. As far as the pulses go on the bottom of the foot, we move down to the posterior tibial and also the dorsalis pedis. The dorsalis pedis is along the line of the big toe. You can move it up with the 2 fingers, the index finger and the middle finger, and you can feel it. Right there. Posterior tibial is the medial aspect behind the middle of the ankle, kind of where the Achilles tendon is, right here. It's usually easier for me to find and feel in patients. Side 2. So all of his seem to be +2, which is normal. None feel weak, none feel bounding. And also asking if there's any numbness, tingling, any pain. These are all other signs that we want to address with the patient. And are you having any pain?
No.
Chest pain?
No.
No numbness?
No.
I think that sums up the cardiovascular system.